Well, here we go again, Rachel. Taking an incredibly taboo topic, one that really still is taboo, urinary incontinence, and bringing it to our audience and to the top of people's minds with a smile on our faces.
And it's funny because we both have smiles on our faces after speaking about incontinence for the last half hour because, when you're speaking to somebody who's so comfortable with it, and sometimes you and I have that experience and sometimes we don't, but Karen Brunet, who's the founder of Control Plus, who you'll meet, just seems to bring all the energy and passion to this
Yeah,
to make it accessible.
absolutely. We've been speaking so much to her about a particular type of incontinence called stress incontinence. So I just want to put that out there because her solution is specific to that issue.
So let's hear from Karen.
Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so happy to have the founder of Control Plus with us today, Karen Brunet. Karen is building a company and a solution around a problem that affects millions of people, and we're so happy you're here to talk about it.
Thank you so much for having me. And I never thought building a business because I pee my pants would become such a big thing.
We hear a lot of stories like that.
Yeah.
Absolutely. Absolutely. So tell us where this begins and where and more about Control Plus.
For sure. Well, I think it begins with frustration. I mean, I'm not going to go too much into my medical history, but I went undiagnosed with endometriosis and polycystic ovarian syndrome from the time I was, I not even a teen until I was 30 years old. Went through fertility treatments, wasn't successful, went off the fertility treatments, saw an osteopath who worked on me, like a pelvic floor specialist osteopath, and had two miracle daughters. Yeah, the day my second daughter was born, 16 months after my first, was when my leak started. And I thought it would get better with Kegels and a pelvic floor therapist, and it did to a point, but really it was Control Plus was built out of frustration. I'd had enough. Like my symptoms have been swept under the rug for so many years, gaslit, by the healthcare community on all of my symptoms from endo and polycystic. And so when I went to my, obstetrician gynecologist after my second daughter was born, I said, "What's up? Like, what is happening to my body?" And I was offered two things. We can do sling surgery, and I'd already been in the medical business and neurological side of it long enough to know that there's significant side effects to that surgery. I think there's upwards of $14 billion in lawsuits for it. Or we'll fit you with a pessary. And I also knew what pessaries were. And I'll tell you, any woman, it doesn't matter any age, I say my age, I was 37 at the time, to be fitted with a pessary when you're still menstruating and sexually active is not an option for me. So then he said, well, then I guess you can wear pads. And I'm pretty athletic. I've been athletic my whole life between training horses and doing triathlons and running for many, many years. Wearing pads really doesn't cut it. I mean, they
Yeah.
stink and they're irritating and they're bulky and just not comfortable. So
Alyssa, to level set people, the way Karen's
Yeah.
describing it, the connection between endo, PCOS, fertility issues, and incontinence, can you give us the way you do
the perfect storm.
take very complex issues and make them make sense and how they might
Yeah.
connect from a medical and hormonal perspective?
Absolutely. Well, first of all, congrats on your daughters. Let me take a deep breath because this is a pretty tall order type of question. Endometriosis, PCOS, I don't think we're going to go into those in big detail, but suffice it to say, it is still unbelievable to me, and I'm in practice almost 30 years, how long it takes for these entities to be formally diagnosed in a person. I
Mhm.
think we have found the 7 year mark, particularly for endometriosis, because people have so many symptoms leading up to before they get diagnosed. With that said, whether related to those two entities or not, urinary incontinence, and very specifically stress urinary incontinence, is incredibly common. And for audience who may not be familiar, stress urinary incontinence means involuntary, unwanted leakage of urine with some sort of strain or stress called like a Valsalva maneuver, like coughing, sneezing, exercising, running,
Laughing.
exactly what you're speaking about,
Picking
laughing.
something up.
Absolutely. And, for young women especially, but really for anybody, this is, horribly uncomfortable. It creates a lot of shame and embarrassment. And there really are not a lot of wonderful solutions that are easily obtained or that people are interested in, other than pads, which is a massive market. With that said, tell us about the device that you've created. I assume you're the inventor of this, and how it works, and tell us all about it and how it's helping you.
For sure. So I went on a journey of research, saw that I wasn't the only one suffering, because I think a lot of women think that, number one, that it's normalized after childbirth, or that it's, a senior's problem. So I always say, the bladder leaks or stress urinary incontinence, it's almost like a house of cards. It starts here, and then all of a sudden you stop doing this activity and you stop being social, and then you gain weight, and then the depression happens. Like it really is. You think it's a small problem, but it's life changing. So I tried everything that I could find on the market, and many of them worked. It stopped the leaks, but they weren't comfortable, or they were painful to insert,
Yeah,
or they shifted during a hard workout. So I designed Control Plus to move with you as you move. So it's virtually undetectable, like a menstrual cup. Menstrual cups, you really don't feel them because they're hollow and they move with you. The other pain point with traditional pessaries, they can be difficult to remove. Even
yeah,
menstrual cups can be difficult to remove because they suction inside. I'm sure you can touch on it, Dr. Dweck, that the
yeah.
vagina wants to hold things in. So we added a string, or I added a string. I did beta type 3D printing, and I was like, okay, this is working. I'm my own guinea pig. And the one thing was, sometimes after long periods of time, it was hard to find it to pull it out. So by adding this as an FDA cleared tampon string, when you pull this string, it recollapses the pessary, releases that suction, and pulls it back down the vaginal canal, so it's easily removed. Um, and then then the other thing was full on comfort. I wanted something that
Yeah.
was effective and comfortable, that you could wear all day, and not worry that when you're having a bowel movement or doing a strenuous workout that it would start to slip.
So, from what I can see and what I understand, the actual mechanism by which this works is that the device almost changes the angle and the support of the urethra
Yeah,
so that when you do strain, whatever activity is causing that, urine cannot come out because it's being
exactly.
supported. Yeah.
It's supported, but flexibly supported. So,
What is it made of? What is the device made of?
yeah, so it's made of medical grade materials, that have actually been used in cochlear implants, in ears for decades without any incident reported to the FDA. It's known for its flexibility, but it's especially known for its, water resistant. So as soon as this gets wet with water, it's very slippery to insert. I compare it to your spatula at home. So your spatula is almost rubbery when you touch it, but as soon as it touches water or anything, it slides off.
So
So
it's silicone or
it's not
I
silicone. It's called Santoprene. So
okay,
because it's not silicone, you can use silicone-based, lubricants with it, or water-based lubricants.
okay.
The difference between the two is silicone-based lubricants can be extra slippery, and because this is slippery when it's wet, only if women are experiencing, vaginal dryness, only a small amount is needed for insertion. For removal, again, if vaginal dryness is a problem, while it's inserted, just a small amount of water-based lubricant or silicone on the outside, just to help, with the comfort.
And is there a big learning curve? What I see with some of my younger patients who are using menstrual cups or even discs, there is a bit of a learning curve getting this in and out. comfortably so that it's like riding a bike and you don't have to think about it anymore? Would you say there's a big learning curve here, or does it just is it intuitive?
So it could be, it's not a steep learning curve. We've been really diligent on our instructions for use. We have, if you look on the website, we have a great animation, and we're actually working on another one that's even more thorough. Women size themselves. So the starter kit, which comes in the three sizes here, or I can show the packaging after.
Yeah, great.
Women start with the size small. It's folded just like a menstrual cup for insertion, like this. It's inserted in the vagina this way, so this sits up near the cervix.
Yeah,
And then we tell women bear down, cough, do a jumping jack, and if your leaks
hmm
have stopped and it's comfortable, and I should insist that it's pushed through the pubic bone. So as soon as you
yeah,
feel it go underneath the pubic bone, give it an extra little push, and you know it's in place. So if it's working, then you found your size. If you find that it's slipping out, your leaks have returned, then you go up to the next size
got it.
until you find the size that works for you. And I shouldn't say the size is meant for the size of the vaginal canal. There's some women that are tiny that need the larger size because it's
Yeah,
firmer as well, so they need more support.
right. I noticed on the website that you need to be quote unquote diagnosed with stage two pelvic organ prolapse to qualify for this. How
No.
does some, that is not the
Not
case?
not not diagnose any woman who's been diagnosed or has stage two and above probably won't successfully use Control Plus just because of how slippery it is. So with uterine prolapse, it's going to push, it's when the uterus comes through the cervix, it will push this out. Up to grade two cystocele, which is that drop of the
Hmm
bladder, the way that
Yeah,
this is shaped, it will actually for mild cystocele, women can still use this successfully. So the rule of thumb we use, if you can retain a tampon or you can retain a menstrual cup, then Control Plus will work for you. Because many women don't know that they have prolapse.
So one of the things I want to discuss is Alyssa had started her question, how does this work? There are other things on the market for incontinence. And when I met you recently at a health conference and in subsequent conversations, we've talked about that. What makes this unique? And why do you think when you launch next month that it's going to be, as Alyssa said, a solution that people can access and that they want to use?
I think what makes it unique is number one, the shape. You can see how it's shaped to fit with your body, not against your body. There are some other products out there that most are rigid,
Yeah.
and push against the bladder or push hard against the urethra or push towards the back of the rectum. Control Plus is designed to actually conform to your body. Again, like I said, move with your body. So even, during the weirdest yoga move, it's going to move with you. That sets us aside. The next thing is that its insertion is easy, like a menstrual cup, because it's folded like
Mhm.
this. So it's very easy to insert. And then again, I was saying to Dr. Dweck that removal of other products can be uncomfortable, but by pulling that string, you're
yeah,
collapsing Control Plus, eliminating that suction, and so it's easy to remove. And we've really designed it for active women. In particular, we beta tested it with a lot of runners. Runners, it's a particular pain point. And
yeah.
when we look at market size, actually, we've seen some terrible statistics. 7 out of 10 women leave their sport, stop going to the gym because of this. The prevalence of it in, volleyball players, basketball players is 75% or more. Um, but usually basketball players and volleyball players, the actual market size drops as women age, where runners actually goes up. So we know
Interesting.
that, there's more runners in the US than there are volleyball players. So we've like I said, we've beta tested it with quite a few runners. In the last 2 years, I can happily say that 100% of them are still using Control Plus. Um,
Have you done formal clinical trials with the device other than the beta studies, or
yes,
were those your clinical trials?
yeah, so we just completed a study with the University of Ottawa, and 90% of the women said it was easy to use, it was comfortable, it was effective, and they would recommend it to a friend. So that
Yeah,
was great. And then we actually looked at other devices, clinical studies in the past, and designed ours. we actually did, it's called vaginal force testing. So it's a compression testing to match other devices on the market.
Yeah.
And that helped with our FDA clearance, was that we were able to say,
Sure.
hey, we match, XYZ's devices for compression, vaginal force, so that we could ensure that it's comfortable and effective.
Look, pessaries, I guess, were the original, the OG of trying to help with some stress incontinence, and they are really not always well tolerated. They are super rigid. They do come in a lot of different shapes, but the main issue is that they are not easily placed or removed
Mhm.
by the user. So I'll have patients who come in, and granted, some of these women are much older, but they come every 3 months to have their pessary taken
Mm.
out, cleaned, inspected, and replaced because they can't possibly do it themselves. And of course, sexual activity of a penetrative nature is absolutely impossible with a pessary. And so this is a removable device, which is great.
My goal is to make, my Control Plus pessary as common and accessible as menstrual cups. Women don't go to you to be fitted with a menstrual cup. We're quite capable of knowing our body and learning our body, and that's again why we want to ensure that we educate our customers as much as possible, whether it's right from our
Mhm.
website or the booklet that we include in the instructions. We have an unbelievable customer support network connected to the website when we hit that go button on January 8th.
I know we have to get to the business side, and Rachel's going to take that away. Just one quick question, because vaginal estrogen is all the rage right now and literally like being placed in the water. Is there any issue with using local vaginal estrogen and this device?
In order, so I should say too, we're the most recently cleared pessary for stress urinary incontinence on the market, which means the FDA is very strict on medical devices for women who are coming through now. Maybe they were a little lax 5 or 10 years ago. I can confidently say they threw the book at us and we we succeeded. So through all of our biocompatibility studies, and we had to test this against many different other products and solvents and such. And because it's not water permeable,
Yeah.
vaginal estrogen cream is fine.
So here's today's hot flash. Here are some known risk factors for genuine stress urinary incontinence. Number one, family history. So you may be able to blame your mother. Number two, having big babies. So if you've had vaginal deliveries of really large babies, that puts you at risk. Number three, not being at ideal body weight. Overweight and obesity can lead to higher risk. And number four, possibly excessive straining over long periods of time.
One of the things that has been such a game changer with female founders in incontinence is thinking about and talking about the many different aspects of your life that are impacted. So you both mentioned a few of them. If you leak and you're concerned about odor, you might be uncomfortable going out of your house or engaging in intimate activity. And I've said this before. I remember doing a focus group with a large number of incontinent women and women suffering from incontinence. And one woman said, I can't even pick up my granddaughter
Mm.
because, and for some reason that was like hit me in the face. That seems like the most basic, primal experience that a person could have. But to think of all the different ways this interferes is really important. And historically, the conversation in the pad market was, how many pads did you use? How much did you leak? And now we're thankfully talking about this aspect of women's health the way we're talking about others, which is understanding that it's not just one little part of her
Well,
life.
and
Um,
you know what? We're ready for a better product for stress urinary incontinence,
yeah,
prolapse, and something that stops the problem instead of just containing it.
yeah. And what is your plan for distribution? What is your go-to-market strategy?
Strictly for the first 6 months to a year, directly from our website. So I should add in that we're prescription cleared, but the way we've set up our website, it's absolutely seamless to get a prescription right from our providers on our website. So from the time you visit our website until your Control Plus kit arrives at your door should be as little as 4 days.
So does that mean your current doctor cannot prescribe this? It has to be prescribed on your site?
We will be. So for the next 6 months, we're working with our provider network that work through our website, which
Okay.
is like a telehealth platform. And
Mhm.
then once that 6 months is up, we'll have like an EHR connected to our website so that we can accept the prescriptions and then still run them through our website. And then we're working our way, should be by the end of next year, maybe sooner, to be direct to consumer over the counter. And then that's when we'll start working with further affiliates programs.
Great.
A-
Because as
And what
Rachel
is,
knows, we know
Yeah.
I never want to be left out of the loop. So I
Mhm.
wanted to clarify that.
what is the plan or timing to enter the US, or you, when you launch, you will also be available for with a prescription in the US?
So we'll be available from the website to get a prescription, right from the website. And then within 6 months, we should be able to open that up to further doctor networks. So Dr. Dweck would be able to have a prescription and have that sent through our website, which works with our pharmacy partner, which is Honeybee Health. So in tandem, again, I want this to be a consumer product, not a medical
Mhm.
device. So we've tried
Yeah,
to set up the company as make it as easy and seamless and private as possible for women, because it's a barrier to entry for
Yeah.
me to make an appointment with you, Dr. Dweck, wait for that appointment, go in for the appointment.
absolutely.
And for you too, it's going to actually free you up to work with more pressing, um, say more pressing problems that women need to see
That
you.
women can't solve without their doctors.
Exactly,
So
exactly.
I want to just ask the question again in a different way. When you launch, do you have physicians who can write prescriptions for consumers in the US and not just Canada?
Yes, we do. So we're
Okay.
not so we're not launching in Canada yet. We do have Health Canada clearance, but it came a lot faster than we thought it would, and we're like, okay, we didn't build that in the model yet. So
Okay.
so
So the
we
launch
have
is US. Okay.
the launch is US, and we're working with a telehealth network that's connected right with our website. So doctors
Yeah.
will prescribe right from there. So the journey for you is to go onto our website. You click shop now, buy now. You fill out a quick survey, 2-minute survey of your symptoms. That immediately goes to our doctor network. And within 4 hours, your prescription comes back and it's sent to Honeybee Health. And then your prescription arrives at your door. Ideally, they'll prescribe our 3-size starter kit so you can fit yourself. And then with 11 refills, up to 11 refills for single sizes.
So
So
that was my next question. How many days in a row can you use it? And what is the price point of the starter kit and then the refills?
yeah, so we're cleared with the FDA for 30 to 90 uses. Why such a broad a scale? So I mean, I don't know if this is the right way to compare this, but the way that Control Plus is designed, think of a pair of running shoes. So your running
Good
shoes.
analogy.
So if
Hmm.
you're a walker, a few times a week, your running shoes will last 6 months or longer.
Yeah.
If you are training for a marathon, you need to replace those running shoes like every 30 days or every 500 kilometers or whatever it is. So what happens over time, and I can show you. So this is an intact Control Plus, right?
Hmm.
See, it's flexible. Maybe I've been beating this one up a bit, so it's a little more flexible than it usually is. What happens over time, and we can't say whether it's 30 to 60 times, is that it just gets a split. And when that split happens, it gets weaker and your leaks come back and you know to replace it. So,
So is this to be used on like an everyday, all day basis or just in preparation or preventatively during exercise or what have you? Because I really could see like almost two use cases. And I just wonder what was the original intention?
so some women right now, it's part of their daily routine. You get up, have your coffee, brush your teeth, and use your Control Plus and take it out before bed. Throw the string in the garbage. We provide 90 extra strings. Wash it. I should say wash your hands well with soap and water before using it. We sell it non-sterile. You just use a
Hmm.
mild soap to clean it, no boiling needed.
Yeah.
And then so some women need it all day, every day, and it really takes away the worry in your day. I said, as women, there's so much thrown at us during the day. Having bladder leaks is just one more worry that's always in the back of our head. So some women feel confident, more confident wearing it all day. Myself, I'm to the point that I really only use it, number one, if I have a bad cold, I need to wear it all day. But usually just when I work out and I run.
And what does one do if they're menstruating? Is it compatible with anything or is it you just So I'm
So,
into
so
using a
that's
pad.
a great question. So we're not cleared for use during menstruation yet. So we always
Mhm.
recommend women use, organic cotton pads or absorbable underwear for that. But we're starting a new study in the next few months for that exact reason. Because it's hollow, you could use, and we'll test it out with the use for pads and also the use with an organic cotton tampon.
Yeah. I do have two other med questions, if that's okay, because of course my mind is spinning in a thousand directions. With some of the menstrual cups, especially if somebody is not well versed in removal and if it feels like they're pulling out a plunger and there's a whole lot of pressure there, we have trouble with potential malposition of IUDs.
Mhm.
Is there any concern with the use of this product and an IUD and dislodging it in any way?
Yeah, so we've looked at another product that's available in Europe that's been on the market for, a decade or so, and it's been used very successfully for
Yeah.
use with IUDs. I mean, I think the only worry is there may be some irritation if the strings are there, because some women, depending on how long their introitus is, this could sit right at the cervix or it could sit
Yeah.
below. So really that might be a trial thing. Now we did successfully, women have used it during our studies with an IUD, which is great.
No
So we've
trouble.
actually taken that off of our contraindications that women with
Okay.
IUDs can use it.
And the replaceable string, which is so novel. And I didn't know if that was for, just to get rid of the ick factor, if you will, because I assume some people are wearing the device while urinating and whatnot. Or is it actually for sanitary purposes that were studied, like to prevent infection or toxic shock or something along that line?
Well, I can say that this particular string came as a pivot, and as founders know, you hit roadblocks all the time.
Hmm.
So
Hmm.
I designed and actually have patented a silicone removal string that's reusable. And when we presented that to the FDA, along with all of our biocompatibility safety studies, they said, "Well, why didn't you test the string?" And I said, "Well, it's medical grade silicone." And they said, "No, no, you need to do all the same amount of testing that you did on the pessary that you did on the string." And I did not have a budget for that. So I reached out to, actually, and I don't think she'll mind the plug, Greta at Sequel Tampons,
Sure.
and and
A friend of the
said, "Hey, Greta,
podcast. She
okay, you're the most recently FDA cleared tampon on the market. Who makes it, and where did the string come from?" So she actually helped me work with their manufacturer to get that tampon string, and so that we're safe and FDA.
Yeah, I had a
And this,
feeling there was more to the string story than met the eye. So thank you
yes.
for that.
Yeah, for sure. And some women don't need it at all. I mean, I don't use it anymore. I'm comfortable with my product, but I think for new users,
Yeah,
it's really a comfort thing that, it's not going to get lost in there. And oh, if I pull the string, it's going to collapse it and I'm not going to lose it. Now, I'll say, just like with menstrual cups, if women are nervous, your pelvic floor does this. So, again, in our instructions, take a deep breath, relax, try again. Go walk away
yeah,
for 20 minutes, try again.
So I
yeah.
want
For
to
the
ask you to
yeah,
clarify something that you've both said. So you were talking about, Alyssa, how people come to have their pessaries removed. We've talked about this as a very different experience than a pessary, but in the conversation, we're also describing the product category as a pessary. And I just want to make sure people understand that one is a categorical description and the
yeah.
other one is how it's used. So if you could clarify that a little bit, I want to just make sure if people think pessary is a dirty word, that they don't confuse control plus in that way.
I think I
That
think
is
when we
such a
hear the
good
word
question.
I
Yeah.
think when we hear the word pessary, we wince, right?
In
Um,
gynecology world, a pessary means a very particular type of device
mhm.
that has been around like literally it feels like since the dark ages and appears that way, to be quite honest. So I would say that for healthcare providers a pessary is more of an actual device.
Yes, and I agree with you, Rachel, that we're categorized as a pessary, but we've made it very clear in our branding: bladder support, bladder support, bladder support.
Great.
Yeah, so it sounds more inviting.
I just wanted to say, we talk about these kind of topics all the time and, think it's for sport and for profit. So I was really struck by how you bring humor, into the conversation. So I'd love you to share what you did at the conference where I first saw Control Plus and I first met you.
For sure. So I was on a bit of a winning streak through August on these pitch competitions, and we did open up a seed round of investment in September. So I'd won a pitch to be at Boston, and it was, a 10-minute pitch, and it was kind of almost too long. And then I won this pitch to be at Health in Las Vegas, and that's where you saw me, Rachel. And I had 2.5 minutes. I thought, how can I describe this product in two
With 10
and a half
other companies that
with
people were
10
watching.
Exactly. So what can I do to stand out? And I said to my team, I said, "Do you think you can get me a mini trampoline sent to Las Vegas?" And they said, "What?" And I said, "Yeah, one of those collapsible ones that, I can just get at the hotel and bring to the stage." So we put a mini collapsible trampoline on the stage, and I did half my pitch on the trampoline with a sprained ankle, I'll add. Nobody knew that.
No
But
one knew that because it wasn't
yeah.
related to incontinence.
Yeah, yeah. So I started out my pitch like that and brought some humor to it. And I had a big picture of my youngest daughter right after she was born. She was only a few weeks old, and it was her birthday the day I pitched. So I said, "Look at that beautiful baby up there. It's her 14th birthday today." And I said, "She gifted me my bladder leaks 14 years ago." And the audience roared, and I
Yeah.
actually got a lot of high fives from women and some hugs after that because they said, "I haven't jumped on a trampoline since I was 20 or since before I had my kids." And I'm trying to make the brand relatable. So when women go on our website or they see me, that we're a real person. I'm not a doctor. I don't have that any medical degree that I hope other women can find some humor in it. Know that it's not necessarily a rite of passage, but it's normalizing, destigmatizing the condition. And
Yeah, I mean, you literally read my mind, Rachel, because this story is great. And look, of all the people that were laughing or applauding in the audience, there was probably another huge group that really wanted to still keep it kind of silent because not everybody is willing to admit to this issue quite yet. And I think this is a really good subject to almost close with. Do you think that the stigma of urinary leakage and your solution for it is going to come the way of menopause, where it's spoken about, it's on top of everybody's mind, it has been normalized for the most part? Are we getting there?
I think we're getting there. I mean, every woman goes through perimenopause. Every woman goes through menopause. If 1 in 3 women, or I think it's higher than that, as you reach perimenopause and menopause, maybe 1 out of 2 women have it. It's bound to be part of this whole new conversation, and as it should be. And it's time that there are more innovative products. I think I got up there on the stage and I said, "It's about damn time that we have something better for a condition that affects millions of women around the world."
Yeah.
So you're weeks away from launch. It's going to be a busy holiday season for you. Share where people can find you and when, because I'm sure there will be people listening to this who will say, Karen gets me. Where do I find this?
I should add too that eventually we'll have a closed group on our website so women can talk to each other and
Yeah.
share swap stories or success stories, and so again, breaking that stigma, having a space where women can feel comfortable to talk about it. So you'll be able to order Control Plus off of our website, which is cntrlplus.com, cntrlplus.com. And from there, the added value you get from getting that prescription, it's $20 for the prescription. It's $139 for the starter kit, and there is insurance reimbursement available for that because it is a medical device. For that $20, the added value you get is that you have unlimited messaging to that doctor who's prescribed for 12 months around Control Plus. So if there's something that's maybe our customer support can't answer, you have access to reach out to your doctor and say, maybe vaginal dryness is a problem, and they'll be able to steer you towards, vaginal estrogen, or
Right. Yeah.
use this water-based lubricant. So we're actually really excited to be able to provide that for women. So it's not just that hurdle or speed bump about getting prescription; it's actually a positive experience.
Right.
Well, we will be watching and cheering you on. This has really been great. Thank you so much for joining us.
Thank you, and please keep the conversation going. I think you guys are great.
Don't forget,
Subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.